Welcome to the Compounding Center Connections, where we talk about different health conditions with our partnered practitioners. Our goal is to provide you with information and knowledge on a variety of health-related topics. I'm your host, Jay Gill, a compounding pharmacist from the Compounding Center in Leesburg, Virginia. Here at our pharmacy, we collaborate with practitioners and create custom medications to help our patients get better. In today's episode, we have Jacki Meinhardt, a board-certified nurse practitioner at the Amen Clinic in Reston, Virginia. Welcome, Jacki.
Hi there, Jay. How are you?
Doing good. Thank you for joining us. So can you please introduce yourself to the listeners and viewers and tell us a little bit about yourself?
Absolutely. Number one, thank you so much for having me on. I really enjoy connecting with you and to all of your audience, and hopefully answering any questions that they may have. My name is Jacki Meinhardt. I am a nurse practitioner here at the Amen Clinic in Reston, Virginia, and I have a doctorate in neuroscience from Georgetown University. So basically, what does that mean? I am a nurse practitioner that also looks at integrative medicine and how the brain impacts the body as a whole.
Gotcha. Well, before we get started, to our listeners, I have a disclaimer that everything discussed on this episode is for informational purposes only, not for diagnosis or treatment. So let's begin. So today's discussion is on chronic inflammatory response syndrome, or CIRS. So Jacki, can you tell us what is chronic inflammatory response syndrome?
Absolutely. Thank you for the question. Chronic inflammatory response syndrome, also known as CIRS, CIRS, mold illness, strange illness that I have, right, that people come and see me, is a multi-symptom health condition that typically happens over the course of time, right? Patients will present either with one symptom or 30 symptoms, all very unique in the sense that the patients have a chronic fatiguing illness. And typically, CIRS is a genetically predisposed illness, meaning there's a genetic risk factor associated with developing the disease, specific to chromosome number 6 or HLA-DRB. And we'll see that these patients who, by and large, have been fine for the majority of their life, maybe they have had a symptom or two before in the past, but typically there is some trigger that happens in their life, whether it be a tick bite, whether it be a bad viral infection, whether it be a physical or emotional traumatic experience, real or perceived, that create this multi-system, meaning multiple body systems, heart, brain, respiratory, skin, and a multi-symptom, meaning they've got fatigue, heart palpitations, they've got brain fog, they've got maybe confusion, maybe they have a rash that they had never had before. They go to their primary care provider, they may go to specialists. In fact, most people have seen up to 10 to 15 doctors before they ever find me. And we start going through those types of symptoms and going through those types of questions to help identify what the root cause of that issue is.
So Jacki, can you repeat, what are some of the common symptoms or signs and symptoms that you come across with this condition?
Absolutely. So oftentimes, more predominantly in female than male, usually 2/3 of my population are women versus 1/3 men. That's not the rule, but it's just what I've seen in practice over the last 8 years. We'll see typically a chronic fatiguing illness. We'll see brain fog, maybe confusion, poor assimilation of new information, meaning someone tells you something and you think, what did they just say? Why did I walk into this room type of a question, right? You forget things, you become very forgetful. Great long-term memory, poor short-term memory. You'll also have maybe body aches and pains that migrate from the right side to the left, to the upper body to the lower body, headaches, vision changes that kind of happen, but then they go away, right? They happen once in a while. usually associated with something called contrast, right? It's a contrast, not an acuity, but a contrast sensitivity. And then, of course, abdominal discomfort, whether it be constipation or diarrhea. I see a lot of loose stool or different types of secretory diarrhea, meaning the patient eats something and they have to run to the bathroom because they can't hold it, right? And then one of the biggest symptoms I see is typically urinary frequency, meaning they pee more than they should for what they drink.
Gotcha. So the first, when you were mentioning
that's just a couple. That's just a couple of the symptoms.
But some of the symptoms are so overlapping with other conditions. So is this something that is often misdiagnosed perhaps, or is there even a test available for this? Is there such a thing?
Yes, absolutely. The answer is yes to both of those questions. Yes. And yes, there's most of the time people go see their primary care provider, as they should. They should go see their primary care provider, and the primary care provider says there's no way that this one person can have this many symptoms, right? I've heard that so many times. I have also heard where the primary care provider says, come back once a week and we'll go through each symptom, right? One symptom a week type of a thing. Wow. And they'll be diagnosed with chronic fatigue, fibromyalgia, headaches, migraines, cognitive impairment or subjective cognitive impairment. They'll be diagnosed with atypical arthritis or atypical pain syndrome, urinary frequency, and they'll be prescribed Nubetric, right, for overactive bladder, when really it's not an overactive bladder. They have actually a dysfunction in that negative feedback loop associated with the adrenal glands. And that can all be diagnosed with blood work, right? So most of the blood work that I do, I want to say about 99% of it is typically done at LabCorp, so a national laboratory. And again, typically covered by insurance. Of course, always please check with your insurance before you ever do any blood work if you're concerned about the price. But typically covered by insurance. There is actually a new test available called the GENIE test, which is actually specific to CIRS and to some other types of symptoms as well. But that is a newer cutting edge test available on the market.
Gotcha. I'll make sure to put that in our show notes for our listeners. So at the Amen Clinic, could you walk our listeners through how do you kind of triage a person, or even discuss perhaps your success stories with a patient that you have diagnosed with CIRS and they've gotten better?
Absolutely. And I actually just saw one just the other day, actually the end of last week, a great success story. We had a young lady who I want to say is in the prime of her life, in the 25-ish, 26-ish year olds, female, who had had a chronic fatiguing illness for so long, had to quit her job. She was on disability, had to move home with her family because she couldn't afford rent in her group, her multiple roommate home that she was living in, or apartment, condo, whatever. And she moved home with her parents. Her parents were kind of frustrated, didn't know what to do. They ended up coming in to see me through word of mouth, finding me through word of mouth. And we went through the blood work. I put her on some different types of protocols. And I want to say it's been about 6 months, but she is roughly 45 to 50% better. She's now out of bed, being able to accomplish more in her day, not nearly done with treatment, but as far as functional mobility, getting her activities of daily living done, being able to cognitively figure out what she needs to get done every day, slowly those activities, that behavior is coming back to her. And her parents are delighted, right? Because she's acting like a 25-year-old, right? Like how we want our families to be, right? Because a parent would do anything to help their kid feel better, right? And I get that. As a parent myself, I totally understand that. But it was, first of all, when she comes in, she, again, found me through word of mouth, made the appointment. And then it was validation, right? I was talking to her, figured out what blood work I wanted to do. But then once I got the results, it validated the fact that this was actually a real illness, right? This was a real syndrome that she was experiencing. There's a name for it, right? And there is a treatment protocol for it that is highly individual based, right? So there is a general protocol, but then there's things that you can add to it depending on how that patient presents. And, in different types of conditions conditions that you're treating with, like different types of, if they have bacterial infections or viral infections, if they have any sort of genetic haplotypes that we need to know about as far as how their body metabolizes different types of medications. It's much bigger than just one blood test, right? But once we figured out and put her on figured out what the underlying issue is, all through blood work, and then we put her on a protocol, it was a little bit slow at first. The first couple months are usually the hardest, but then I'm happy to say the patient's feeling so much better, and she's realizing how cruddy she felt before. So now we're doing a lot of that support, that mental health support that goes along with treatment. When you realize, wow, I've just spent 3 years of my life not feeling well, and now I'm feeling well. Right. And so there's a lot of mental support that goes in there, mental health issues that come up. And then COVID on top of that, right, with all of the different types of mental health challenges we've had. So it's a multimodal syndrome, right? And it calls for a multimodal type of treatment. And I'm lucky to work with mental health experts, right? Brain health experts like Dr. Amen. And that's been transitional in my development as a provider as well. Is, if you don't have access to some of the different newer treatments that people are using in the mental health world, you just don't know about it, right? So now here I am actually learning more about something that I didn't know as much about, mental health modalities.
Gotcha. Now, it sounds like the treatment protocol is very specific to the person.
Yep.
Can you share some treatment options, not necessarily the protocol, but what things that you may have a person start on or use or anything like that?
Yes, absolutely. Absolutely. So first of all, I prefer to do more natural products, to do things through either supplements, food, right? Because believe it or not, food is medicine,
Yes.
be thy food, the Hippocrates, but then also looking at different types of supportive measures as well for the body, whether it be different types of saunas, whether it be different types of light therapy, walking, right? Just exercise as well, moving that body, a body in motion, a body that is at rest, really should be moving, right? So we talk about the circulatory system, we talk about the lymphatic system, we talk about the glymphatic system in the brain specifically. But typically when we start off treatment, we're looking at different types of, now this is me specific to what I like to go after typically with patients, is membrane support. So I actually go to the cellular level and I look at the mitochondria and how that cell behaves, typically speaking, right? So I'm looking at really high fats, not fats to make you chubby, right? But different types of fats like fish oil, phosphatidylcholine, phosphatidylendinolamine, inositol, different types of membrane support. We start that, just generally speaking, while we are doing the blood work in different types of diagnostic testing. Once the blood work comes back and I can figure out what's wrong with that patient, we start looking at different types of treatment modalities that typically help clear the system of inflammation, right? So whether it be a binder, whether that be supplements like NAC, milk thistle, cat's claw, different types of supplements to assist with clearing the body, we'll start with that. And then I start looking for different types of bacteria or viruses. As we know, bacteria, virus, and parasites, they can create different types of unhealthy environments in the body that once you clear those, you open up all those detoxification pathways, right? You allow the liver and kidney to work the way they're supposed to. And that assists in all that health and healing.
Now, in the beginning of the episode, you mentioned about mold sickness. Now, could you talk a little bit about how mold sickness triggers this, and can you recover from mold sickness?
Absolutely. That's a great question. And it's what we know now is it's so much bigger than mold, right? It is. In the beginning, we thought that it was just mold, but now we know that yes, it's mold, but then there's also other types of bacteria that are associated that grow in the presence of mold, something called actinomycetes, or different things like Corynebacter. Dr. Shoemaker, Dr. Heyman, and I actually published an article just in October of last year, looking at actinomyces and coronobacter, drug-resistant bacteria in relationship to health and wellness, or the absence of health and wellness, I should say. And, it's pretty fantastic work when we start looking at how mold, how bacteria affect the body. And that's now leading us down the question of, how else is this affecting the body? How are these people getting these bacteria, right? These drug-resistant bacteria, meaning antibiotic-resistant bacteria. How do you treat it, right? Because that becomes important too. So a patient could be exposed to water-damaged building, whether it be through the leaky pipes, leaky roof, leaky basement, musty odors. Those are easy ways to figure out if there's been water damage, right? But then also people think, oh, well, I dried it up. I got it all nice and dry, and maybe I put a fan on it. Not necessarily the only thing that you can do, right? You really should bring someone who is experienced remediator in to make sure that everything's been done for that environment, that it's been treated, remediated, and the work's been completed. Always retest the environment, right? You're looking at if there's different types of mold or bacteria in that environment. Again, you're looking at a mold test, you're looking at actinomyces, you're looking at coronobacterium, you're looking at those types of different treatment or testing modalities. And then once you identify that the environment is a certain way, you then bring in the remediators. You bring in air filters, air scrubbers, you bring in different types of ways to help that patient if they have to stay in the environment. Not ideal, but if they have to, how they can best prepare themselves to take care of themselves in that environment. Yeah.
Now, you mentioned Dr. Shoemaker.
Yeah.
So you are Shoemaker certified practitioner.
Mm-hmm.
And could you explain to us, what does that mean? Explain to us about that.
Absolutely. Thank you for the question. Dr. Shoemaker, his name is Richard Shoemaker, or Richie Shoemaker. He is a medical physician in Southern Maryland, specifically Pocomoke, which is actually the western shore of Maryland. He is down by the bridge that connects down by Solomon's Island, down that way, the bridge that connects Virginia Beach to Maryland. And he is just a blessing, Dr. Shoemaker. He discovered what is now termed CIRS back in, I want to say 1992, with the fish kills in North Carolina. There was, I don't know if you remember this, but in the Chesapeake Bay, in North Carolina, the Chesapeake Bay area of Maryland, there were these fish kills, and the fish were just showing up dead on the river. And I remember that because I was working at Johns Hopkins in the emergency department as a nurse. This is way back in the early 1990s. And I remember seeing him on the news and saying, oh my gosh, like, this is so weird, because I swim in the Chesapeake, right? Like, if you swim, you play in the Chesapeake in the summer times. And I remember that stuck with me, right? And then years later, here I find myself working with him, and it's such an honor because he's really changed the way medicine is looked at, right? Different types of integrated medicine and traditional medicine as well. We're now using a lot of these modalities with COVID, which is really fascinating. But anyways, Dr. Shoemaker, through an arduous process, he discovered CIRS. And that was, again, in the mid 1990s. I was introduced to him in 2014-ish timeframe in that area. And I trained with him specifically, one-on-one with him, and then also with a gentleman by the name of Dr. Andy Heyman, who is another brilliant physician who has molded traditional and integrative medicine as well. Truly blessed to have met and worked with both gentlemen. Dr. Shoemaker created this protocol, right, through trial and error from the 1990s all the way till now, working with patients. And he found that patients were getting better. In fact, his treatment protocol was identified in the 2008 Government Accountability Office as the definition of treatment for water damaged buildings. So this is actually a government approved protocol, right? Again, to the Government Accountability Office of, it's either 2008 or 2009. I apologize, I don't know the specific date. But again, and we have a diagnostic criteria, we have a treatment protocol, but most importantly, the patients get better. right? That's actually a part of the protocol, is people have to improve. And through the years since then, since 2008, the protocol has evolved, right? It has developed. It has certainly, we find things, again, like I said, this is individually dependent, right? So if someone requires a treatment, we give it to them, right? Versus, and this is using good medical judgment at the same time. Again, I'm classically trained, Villanova, Georgetown, George Washington University. But then also looking at integrative medicine, right? Root cause analysis. Why is this person behaving the way they are? Why is their body not functioning normally? And that really takes time and a lot of thought, right? You have to slowly start putting the blood work together, but then it's not just about the blood work. It's also about the signs and symptoms, right? Of that patient is exhibiting. It has to do with the diagnostics. When you examine the patient, gone are the days, with traditional medicine these days, you're in 15 minutes, you're out, within 15 to 30 minutes from an appointment. I mean, I spend an hour with my patients going over specific questions and diagnostics with people. People say to me, Jacki, you're so thorough. No one's ever asked me these questions before. And to me, I'm like, wow, I feel honored, right, that I get to interact with this person. But then I think, wow, that really stinks that people haven't asked you these questions before. If you just sit and think about that statement. So I'm blessed to be here. I'm blessed that, I'm working at the Amen Clinic. Certainly it's been a fantastic learning experience for me and for them, right? We're all learning together as far as this is concerned with their mental health background and my chronic inflammatory response syndrome background. We're noticing more and more that this is a brain health issue. It's not just one symptom. This affects every single part of a person's life. Most importantly, the final common pathway is always the brain. You always protect the brain.
Wow. Well, Jacki, thanks for sharing all this information with us. Now, how does someone reach out to you or get in touch with you?
Yes, absolutely. Well, if you see me here in Leesburg, just go ahead and stop and say hi. I'm always willing to stop and chat. I love talking to people. And then my clinic phone number is 703-880-4000. And then the email is Reston, RESTON, PCC @amenclinic.com, AMENCLINIC.com.
Okay, I'm going to make sure to put that in the show notes also. So thank you for tuning in to the Compounding Center Connections. We hope you found this information presented today to be helpful. Jacki, thank you very much for joining us on this episode. Totally appreciate your time. So if you have any questions or comments, please feel free to reach out to me at j@compoundingcenter.com. and subscribe to our YouTube channel and our podcast channel, The Compounding Center Connections, and stay tuned for future episodes. Thank you, Jacki.
Thank you, Jay. Great to see you.